Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Today I'd like to talk about endometriosis and how it affects your fertility potential. So before we begin, let's try to understand what endometriosis is. So endometriosis is the phenomenon where the tissue that lines your uterus is formed in other places. It's inside the uterus and also in some parts of the reproductive system in your body. Then it is called as endometriosis. It causes a little bit of pain or discomfort or bloating depending on the stage or the severity of the disorder. So it can be formed anywhere. It can be on your ovaries, inside your tubes, outside of your uterus, in the cervical canal. It can be in a lot of places, and based on the grade, so they are graded, they are staged according to the severity, and based on the severity, the problem also is very complex. It is defined as stage 1, 2, 3 or 4. Now, women with endometriosis, about 30 to 50% have been also suffer from infertility, and that's because it influences fertility in a lot of ways. As in, the atmosphere inside the uterus per se can be affected, the anatomy of the tube also can be affected, it can be blocked as well. It can also affect the way the tube opens onto the ovaries, because the anatomy is distorted, so the place also is altered. It can also form cysts inside ovaries, as in they are filled with endometriotic fluid. So these cysts influence the hormonal capacity of the ovary, and therefore eggs are not released. Even if the eggs are released and formed, the quality is quite poor. So that way endometriosis can affect fertility depending on the stage. So stage 1 and stage 2 have been known to be treated, and many women go on to have pregnancies with stage 1 and stage 2 endometriosis. But stage 3 and stage 4, which drastically bring down your fertility potential, for such patients, either the surgical intervention is what is suggested, because then what happens is, laparoscopically, all these spots where the endometriotic tissue is growing, it could be outside, inside tubes, inside the ovaries, these tissues are surgically removed, and then the patient is taken up for assisted reproductive technology, or they can also be allowed to try on their own if the effect has come down. Now, to treat endometriosis, basically birth control pills are put. So you have to understand that endometriosis requires an important hormone called estrogen. Now, for endometriosis to build up and cause all the discomfort that it does, estrogen is required. Therefore, to bring down the effect of endometriosis, estrogen is removed from the body by the means of birth control. But for our fertility, what we need is also estrogen. Therefore, for such patients, what's done is basically give them surgical help, give them surgical options, and after that these patients are taken up for ART as well. So endometriosis is curable, but the point is to balance it with your age and the stage of endometriosis. So if you have endometriosis and the signs that you will be seeing are extreme pain during periods, or frequent bleeding, or pain during sex, or pain during when you're going to the bathroom as well. So these are indications that you can make out when you are suffering from endometriosis. Of course, infertility is another very big thing, where when you go for a scan and you're not getting pregnant, and you go for a scan and your doctor says that you have a endometrioma, the cyst which is full of endometriotic fluid that I was telling you about, the doctor tells you that it's present and then begins to treat you for endometriosis. If you have such queries, if you have such problems, if you want some solution for your infertility related to endometriosis, please do not hesitate to call us on the numbers you see on the screen. Thank you.